It's a big yard. Hey,
they're out there with the blower.
yesterday was the blower, and today they're out there with the blower.
Yesterday was the big lawnmower. Today's the blower.
Why would they not do it all in one day? I don't know.
I don't know. They need to charge more for it. I don't know.
Do you want to share your screen?
Okie dokie. All right, confirm I'm sharing.
Yes.
Sweet.
Your screen. So we're going to go ahead and get started. I'm lucky and excited to announce Denise Anderson and introduce her. She is incredible. And today is going to be all about you and deciding how do you find the right plan? What are things you should consider? And it will be filled with information. So grab a notebook and a pen if you don't have one, so you can take notes feverishly. And we will also send out some checklists and some guides and things like that at the end of the week. So you have all of this information in one place, but just grab a notebook just in case, so you can take the notes that are most important right now. And you don't wait on me or my best friend technology, which has not been my best friend this week.
Oh, we love technology. It's definitely fun. So today, like Bethany said, we are going to jump into kind of how to choose your Medicare coverage. I am a Medicare benefits advisor. I am also the managing broker of a general agency. So I have brokers who I provide compliance and guidance to and training. But my number one goal in life is to make sure that you, the Medicare beneficiary, is a good consumer. So I want to make sure that you have the tools and the knowledge and the understanding of how Medicare works, so that you can make the best of it. It's a benefit that you have paid into, and you deserve the very best coverage for you. So today we're going to kind of get started. Well, we're not going to kind of get started. We're going to get started with a little bit of a review of the 4 parts of Medicare. So if you weren't with us in one of the other training classes, this is going to be a little bit more of a flyby, and but I wanted you to have the foundation. So Medicare comes in parts, and health insurance comes in plans. Sometimes we get a little confused because the part names sound just like the plan names. So just pay attention. Plans and parts, very different. So Part A is your Medicare hospitalization coverage. Most of us receive that with our FICA taxes, so premium free. And it's going to cover your inpatient hospitalization, skilled nursing, hospice, and home health. When we talk about inpatient hospitalization, I usually tell people to refer to that as room and board. Skilled nursing facility, that used to be called convalescent care or rehab. Now we call them skilled nursing facilities, but basically those are the facilities we go to once we've had a qualified hospitalization and we still need a little time to recuperate before we go home on our own. Hospice care is end-of-life care, and home health is not what most people think as a home health provider, somebody to help you with dishes and laundry and dressing and bathing and cooking. These are medical services that are provided to you in your home. So physical therapy or infusion therapy. Part B is your medical coverage. That covers everything else. That's going to cover your doctors, outpatient healthcare, durable medical equipment, and most of your preventive services. Those 2 pieces of Medicare are what we call original Medicare, and those are administered by the federal government. Then we have two other parts of Medicare. We have Part C and Part D. So Part D is our prescription drug coverage, and that one's pretty easy. It helps us pay for our prescription drugs. Part C are Medicare Advantage plans, and they typically include coverage for your Part A, B, and D coverage all in one individual plan. So to understand why you need insurance that works with Original Medicare, many people say, well, can't I just have Part A and B? Well, you can, but there's some cost share involved with it. So if you have just Original Medicare and you have a hospitalization, I'm really sorry about that noise. You have a hospitalization, your deductible for the admission to the hospital is $1,408, and that's per hospitalization. So if you went in January, you went back in July, and you went back in December, per se, you'd be paying that $1,408 every time you're admitted. So we probably want to have something that covers that deductible, because that can get pretty expensive. Then we have our Part B deductible. This year, it's $198. In 2019, it was $185. So it scooches up a little bit every year. The Center for Medicare and Medicaid released that number in December most of the time. So we'll know what that is in a couple months. Part B also has a co-insurance. So co-insurance means the amount you pay with Medicare to pay your bill completely. 20% co-insurance, if you had a doctor's office visit that was $100, you'd probably think, that's not too bad. $20, doctor's visit. Compared to most employer plans, that's very competitive or a really good deal. However, if you had a $100,000 health event, which is easy to do nowadays, that 20% is $20,000. That's quite a bit out of your pocket. So we do have plans that work with Original Medicare to help protect your finances and make sure that you have access to the care you need at a price that you can afford. Medicare doesn't cover everything. So I've said it before, and I'll probably say it until my career is over. Medicare, Original Medicare, they don't care if we can hear, see, or chew. Typically do not provide services for chiropractic, and there's a lot of other things that are not included in Original Medicare. If you have a disease of your eye, ear, or mouth, they will cover that. But vision acuity, so whether you can see me with your glasses on or off, hearing aids, routine dental, so fillings, crowns, there's another noise. Those are not covered by Original Medicare. So some benefits are built into some of the plans that are available for you. So when you're making your list of all the things that you want your Medicare to include, make sure you consider things like vision, dental, hearing, transportation, chiropractic, acupuncture, emergency response systems. All of those things may be available to you in certain types of Medicare plans. Things that Medicare absolutely doesn't cover, no matter what kind of plan you're in: cosmetic surgery, long-term care, and coverage outside of the country. So first, we're going to look at Medicare Advantage plans. Medicare Advantage plans are basically an all-in-one coverage. They are administered by a private health insurance carrier who has a contract with Medicare. Medicare plans are not Medigap or Medicare Supplement plans. They work completely different. Medicare insurance programs, such as Medicare Advantage plan, come in several different wrappers or different styles. But typically, you'll have all of your Part A coverage, you'll have all of your Part B coverage, you'll have all of your Part D drug coverage, and some extra benefits in a Medicare Advantage plan. Medicare Advantage plans typically work with Medicare or medical networks. So what in the world is a medical network? How does it work with my doctors? And how does it work with my insurance? And more importantly, how does it work with me? So we have three components to a medical network. You have a group of physicians, you have your health insurance plan, which dictates what you pay for certain services or coverages, and you have service providers like hospitals and labs. You'll have all three of those pieces of the puzzle in a medical network, and once you understand what medical network or healthcare delivery team you would like to partner with, who you want to receive your care from, makes it a little easier to understand what works best for you. Who pays for what? So a Medicare Advantage plan is a health insurance plan that looks and feels just like maybe the plan you have while you're working. The health insurance pays your doctor's bills, hospital bills, prescription drug costs. That's your insurance plan. It says what pays for what. Your medical or your health insurance plan will have a contract with your medical network, or I call them your healthcare delivery system. They're going to dictate what fees that healthcare delivery system charges you. Most of the time, you'll need to receive all of your care from that in-network medical network. The only exception would be if you have an emergency or urgently needed care and you're outside of your medical network. So caveat, any Medicare plan, if you're traveling within the United States and you have an emergency, you're covered. So I know a lot of people get a little nervous and say, well, what if I'm visiting my children in another state and I have an emergency and I'm away from my home medical network? It's okay. All of the plans have built-in coverage for emergency and urgently needed care. So you will choose your doctors. Your doctors will be part of a medical network. It's important that you choose a medical network that offers you access to the centers of excellence that are in your area that you might want to be partnered with or eligible to receive care from. You will choose only one medical network at a time with your Medicare Advantage plan, but your Medicare Advantage plan may have contracts with multiple medical networks. So just remember, your medical network is your primary care physician's medical group or medical network. So when you're choosing a Part C plan, not only are you choosing the health insurance plan, but you're also going to choose your primary care doctor and his medical network or her medical network. You might find your doctor in the directory listed under multiple networks. You may have specialists or other physicians that you see that may be contracted with your health insurance plan. You also need to make sure they are within the same medical network as your primary care physician. So in most cases, you will just receive care from a in-network physician. I think I'll beat that horse dead here in a minute. Your doctor in the medical network is like a quarterback on the football team. So he is in charge of your health care. He is your primary care doctor, and or she is going to manage all of your health care. So if you have an issue, you're going to see your primary care doctor first. The primary care doctor will determine what specialist may be needed or what testing may be needed for whatever your health condition is, and they will typically refer you to a doctor or a service provider that's part of the medical network and also contracted with your health plan. So we just want to beat this one to home, if you will. You want to just make sure that all of your doctors are within the same network. I have clients who come in all the time and say, I did all my homework. look, I have XYZ plan and all my doctors take XYZ plan, except for the doctors were all part of separate medical networks, so there was no connectivity. When I refer to a doctor as a quarterback on the football team, and I'm not a football pro or even halfway cognizant of the game, but I do know that the quarterback throws the ball. So your doctor's the quarterback, and she's going to throw the ball to another healthcare provider that's on the same field or within the same network. Once they have taken care of whatever your concern is, that specialist or provider is going to throw the ball back to the quarterback, and hopefully you don't need to see the doctor on an ongoing basis. But just think of it as everybody has to be on the same field. We can't throw the ball to a different field. Now, most medical networks and insurance plans will allow you to change throughout the year. So just because you selected plan XYZ for your health insurance and you selected medical network A, if your doctor moves or you find that there's a relationship that you need to update and medical network B would now serve you better, you can make those plan changes, or I'm sorry, that provider change anytime throughout the year. You must stay with your health plan for the entire year, but you can change your providers if you so choose. The other way to cover our expenses with Medicare, original Medicare, so we're talking about that 20% and those deductibles, is a Medicare Supplement plan. The difference between a Medicare Supplement plan and a Medicare Advantage plan in most cases is that a Medicare Supplement plan follows original Medicare. So the only network that you need to be concerned about in this aspect is whether or not your provider is contracted with Medicare. So if your doctor is contracted with Medicare, meaning they can provide services to you as a Medicare beneficiary and bill Medicare, that is the only restriction. You can see any doctor anywhere in the country without a referral as long as they accept Medicare. The supplemental insurance will come in and pay some of the cost or all of the cost that Medicare leaves you with. So that 20% co-insurance, you definitely want to make sure that's covered. That $1,408 deductible for hospitalization, you want to make sure you have coverage for that as well. Medicare Advantage plans can offer additional benefits, such as the vision, hearing, dental. Medicare Supplement plans in some states offer additional benefits as well. They are all administered by private insurance carriers. Medicare Advantage plans, you may find some plans in certain areas that are premium free, meaning you do not pay a monthly premium, or you might find that their premiums are very low, a lot less expensive than what you might expect. Medicare Supplement plans, premiums will vary by state and plan, but you will have a premium. And you will also need to add a Part D drug plan to your coverage lineup if you choose to insure yourself with a Medicare Supplement plan. Wow, it's finally quiet. Goodness. There are several different types of Medicare Advantage plans, and there are more than what we have here. Today, we're looking at just the common types of Medicare Advantage plans. So we have the Medicare Advantage HMOs. So those are the health maintenance organizations, and they do require you to use your medical network, an in-network doctor. If you seek care outside of the medical network for non-emergency care, you'll be responsible for 100% of it. Medicare will not pay a portion and leave you a portion. It's an all or nothing kind of arrangement. So you just want to make sure that if you elect this type of coverage, that you are seeking all in-network providers for care, unless it's an emergency. We have HMO POS. And if there's nothing better about Medicare, it's all the acronyms. So that's a health maintenance organization works very similar to the HMO, but it also has a point of service option. And how that works is you're still going to have your home network of doctors, and the majority of your care should be provided by that network of doctors. But you may also go out of network for a higher cost share as long as the doctor is contracted with Medicare. So in a traditional HMO, you have no coverage, if you will, outside of your medical network. With an HMO POS, point of service, you have your HMO fee structure, which will be very low cost, but you can also seek care from a licensed contracted doctor who accepts Medicare outside of your network, but you will have additional cost share, so higher copays and higher co-insurance. Some POS programs do require a referral from your medical network to go outside, so you would double check with your group before you went off to do this, if that's the coverage that you selected. Then we have PPO. That's the Preferred Provider Organization. HMO acronym and PPO acronym are usually pretty familiar to most of us because that's what we usually have to choose from with our employer coverage. But with a PPO, you can use any doctor or service provider who is contracted with that plan. Most of the PPOs in Medicare have an in-network and out-of-network option as well, kind of similar to the POS, point of service, but it would just be considered an out-of-network doctor, and your copays or co-insurance would be higher. When you talk to your healthcare provider and you ask them what Medicare plans they take, oftentimes they will tell you one of two things. One, they'll say, we take Original Medicare. Ding, we know what that is. That's Medicare A and B, and that would mean that they also will accept payment from a Medicare Supplement carrier, even if they're not contracted. So that will give you an indication of what that provider takes. Sometimes the provider will tell you, we take all Medicare PPOs. Depending on where you're at in the country, there isn't a plethora of all Medicare PPOs. We have lots of PPO options when we're looking at our employer coverage. You know, there's a gamut of carriers that offer PPO coverage. When we look at Medicare Advantage PPOs, when they say all of them, you want to double check with them and ask them if what they really mean is they accept Medicare Supplement, because a lot of people do not know how to refer to a Medicare Supplement plan and call it a PPO. The reason being is because when we worked, we had HMO or PPO, pick one. Now we have HMO, HMO POS, PPOs, we have private fee for service, we have Medicare Supplement plans, we have a lot of different choices, and it can get confusing. So when you're speaking with your provider's office, make sure you're asking them specifically, if they say we take all PPOs, do you mean you take Original Medicare with a supplement? Oh yeah, that's what we mean. Okay. Do you also take PPOs from the various carriers that offer it? Oh, no, we don't do that. We take Original Medicare. So you're not going down the wrong path of researching all these PPOs to find out that your provider is not listed in their provider directory. The other question you may want to ask your providers, are you part of a medical group? If you're currently in an HMO plan and you're moving into Medicare, the step over is very, very easy, and you'll find that the benefits are much richer on general than what you have with your employer coverage. If you are stepping over from employer coverage to Medicare and you want to continue with the same medical group and that same health maintenance organization delivery format, just make sure that your medical group is contracted with the HMO version of the insurance that you're looking at. If you are looking at a Medicare Advantage plan for the very first time and your provider is unsure of whether or not they take your coverage, they will tell you, here's our tax ID, call the carrier. Well, calling the carrier 99.9% of the time with the provider's tax ID doesn't get you the answers that you're looking for. But the carriers are getting better at their online provider search tools. They are up to date, or as up to date as any documentation that we can find. So if you do seek a doctor and a plan, you can choose to look through the provider directory tool. When you're in the provider directory tool, it will call out the provider's medical groups. There's going to be a code there, because we all get reduced to a number at some point in our life, that will be the doctor's ID number for that health plan. You'll want to make a note of that when you go to enroll if you're doing it yourself. When we search for PPO providers, you don't necessarily need to make a note of that medical network, but you might find that your provider is listed with PPO and HMO options as well. There is a provider lookup tool now functional on Medicare.gov, which will tell you if the provider is contracted with Medicare. This is awesome because the provider tool lookup on Medicare.gov has been questionable for years. It still may not be 100% accurate, but it will at least give you a place to do some research on your physicians to ensure that they are contracted with original Medicare. We're brought back the eye chart today because we know everybody loved it so much the other day that we just wanted to have another go around with it. I just wanted to revisit the different plan options with Medigap or Medicare Supplements. Most of us call them Medicare Supplements nowadays, but they are just designed to fill the gap that Medicare leaves on certain items. So that 20% Part B coinsurance, you'll want to make sure that the plan you choose covers that, because a quick $100,000 health event, you don't want to be on the hook for that 20%. You want to make sure that your Part A deductible is covered as well. And you'll see we have quite a few options there. You've got from B all the way across to Part B deductible, Part A deductible, sorry, all the way across. I'm looking at this chart and I might see a boo-boo that I need to get fixed. Plan N also covers the Part A deductible. It does not cover the Part B deductible. So you would retire the Part B deductible for any medical care, and if it required hospitalization, then Plan N would cover that as well. In addition, you would have a $20 copay. Sorry about that, guys. So you do have many options in the Medicare Supplement world that will help cover those costs. We talked about it, and I'll just briefly hit on it, not to belabor it too much. Plan F and Plan C are no longer available in the marketplace. They have first dollar coverage, and with the passing of healthcare reform in 2015, it was removed from the marketplace for anyone who reaches the age of 65 after January 1 of 2020. So if you're new to Medicare, your plan that you're going to want to consider being the top plan, if you will be Plan G. It will cover 100% of everything that Medicare approves but does not pay, less the Part B deductible, which this year is $198. So we talked earlier in the session about enrollment periods. So we have a couple times that we can enroll in Medicare, and I want to kind of backtrack a little bit and make sure you get your enrollment period correctly. So open enrollment which is now considered annual enrollment because Medicare likes to change the acronyms on us just to make sure we're confused, is October 15th through December 7th. This is the time in which, if you are already enrolled in a Medicare Advantage plan, so whether that's prescription drugs or a Part C plan, all inclusive, you can make your plan changes for the following year between October 15th and December 7th. If you are in a Medicare Advantage plan, a Part C plan, and you made this decision during annual enrollment and you're not 100% sure this is where you want to remain for the rest of the year, it used to be called the annual disenrollment period. It's now called the Medicare Advantage open enrollment period. You can make one more change. So you can return to original Medicare, that A and B coverage, and pick up a prescription drug plan if you like during that period of time, or possibly switch to another Medicare Advantage plan. So you kind of get a little bit of a do-over, so to speak. If something changes in your life, you move to a new area, maybe the plan no longer is going to cover your coverage area, you have a special enrollment period. There's a long list of special enrollments, including losing employer coverage as a special enrollment. Those life changes will create a 60-day special enrollment period. So you can make changes if you need to during those times. Our initial enrollment period, that's when we first are eligible for Medicare, and that's the once in a lifetime initial enrollment, is the 3 months before, the month of, and the 3 months following your 65th birthday. You want to make sure you get this right, because if we miss, there's no do-over for enrolling in Medicare on time and correctly. If we make a mistake and we miss our initial enrollment period with Medicare, the next time we can enroll is in Medicare's open enrollment, which is the same time period here, January through March. Your coverage won't be effective until July. That's to enroll in your A and B coverage. So if you miss enrolling when you're 65, that 3 months prior to the month of and the 3 months following your 65th birthday, and you're sitting around the table with your friends and you're like, oh, I didn't enroll in Medicare. I forgot I was turning 65. Your next opportunity to elect Medicare coverage will be starting in January. Your coverage will not begin until July. So you will have a lapse in coverage for that period of time. You'll also receive, lovingly from the Social Security Administration, a late enrollment penalty. That late enrollment penalty will affect both your Part B coverage and your Part D coverage. So we just want to make sure that everybody's squared up with when you need to enroll in Medicare versus when you are allowed to change plans and enroll in new plans with Medicare Advantage. So oftentimes we call October 15th through December 7th open enrollment. We called it that for years. Now we changed it just a little bit. We call it annual enrollment because that is the time you can make plan changes if you're already in Medicare. And your initial enrollment is when you are new to Medicare. You're starting the program from scratch. We're going to talk a little bit more about things to consider when you're deciding on what plan type or design you would like to enroll in. What I do with my clients, and you can do it with yourself as well. If you're DIYing this yourself, this is going to help. And then if you are seeking assistance from someone else, this will help. But what I do with my clients is I have them make a list of their doctors that are non-negotiable. These are the doctors that I see. This is the reason I see them, and I do not want to replace them. Perfect. So are we going to maintain access to care from the doctors and hospitals that we already have and trust? I do have people come in and say, nope, don't like that doctor. I got him with my health plan. I never changed him. Don't want to see him again. Get me somebody new. But that's usually not the case. Usually there's a relationship there that you want to consider. So make a list of all of those providers. Also make a list of any other services that you might want to make sure you have with your Medicare. So whether that's vision or dental, hearing aids, transportation, write it all down. You are going to be so super surprised at what some of the Medicare Advantage plans now cover. There was a change that was made about 2 years ago through the current administration that allowed plans to offer services that they considered social determinants of care. So things that went way outside of your health care could be bundled into Medicare Advantage plans if the carrier so chose. So the thing that threw me back in my chair last year, and there's another one that threw me back in my chair for next year, or last year, meaning this year, because I'm always 6 months ahead of things. One of the carriers for one of the markets that I service, pest control was part of the Medicare Advantage plan now. Pest control, spraying for whatever critters you don't want in your home. Now, it wasn't available for everyone. It was available on a plan that specifically focused on a chronic condition, a chronic care condition. But never in my life would I have ever assumed that a Medicare Advantage plan would pay for an exterminator to come to someone's home. But after I sat down, peeled back the layers of the onion, and I thought, well, actually, that kind of makes sense, right? If we have a situation where maybe we have the possibility of disease being transmitted by critters, if we get rid of the critters, that person potentially has the option to be healthier. So some of the Medicare Advantage plans will offer coverages way beyond whatever you imagined healthcare could include. So we were super excited to see those benefits come down the pike for 2020. And I will give you a little insight on some of the ones I see for 2020. It's good. There's additional benefits there with many of the carriers in many of the regions. Your wellness benefits. So let's make a list of things that we would like to have paid for that help keep us healthy versus treating us when we're ill. Things like gym memberships, phenomenal. Many of the plans use a company called Silver Sneakers across the country. We have a couple, not too many that they partner with. There's a couple, Silver Sneakers, Silver and Fit. Most of these benefits will pay for your gym membership with gyms that they have contracts with. So if you're into yoga or you're doing your Pilates or you like to swim or whatever else, you're lifting weights and whatever else we do at the gym, make a list because you may be eligible to pick up a plan that has a gym membership benefit where you can join multiple gyms. The other thing that you need to consider is your financial wellness. So a lot of people come in to me and tell me, I want the best of the best. Okay. The best of the best is the care that gets you to the providers that you're comfortable with and that you can afford. There's no sense in signing up for a plan because the premium looks like it should be the best plan, meaning the premium's kind of high, so you think you're getting a better bang for your buck. That works with most things in life, but does not work with Medicare and the options you have available. We want to make sure that the coverage you have keeps you well. We also want to make sure that you can afford your coverage and you can afford the services that you need to stay healthy. If we have a certain health condition that we are challenged with, I'll pick on diabetes for a minute. Many of the Medicare Advantage plans offer a chronic care condition program specifically focused to that segment to try to help keep us healthy. So if I have diabetes and I'm looking at my options, I might choose a chronic care diabetes plan because there's more benefits in there to help me manage my disease and help keep me well. It also might help alleviate some of my financial costs. Maybe I'll have lower cost insulin. If I am low income or I need help paying for my prescription drugs, I can qualify, hopefully, for some assistance either through the federal government or the state, and I may be eligible for a plan that coordinates the benefits that I would receive through Medicaid or Medi-Cal if you're in California, and Medicare. So there's a lot of things that you want to consider when you're choosing your plan. Picking the most expensive plan may very well work for some of us, but it may not work for all of us. Having freedom to choose our doctors, it works for some of us. Some of us wouldn't know how to begin to find a doctor for a specialty that we wanted to treat. We're going to hit Google. I tell people usually good doctors usually know good doctors. So if you're okay with your doctors helping you choose your healthcare delivery system or your other providers, that helps you get additional options available to you. So where I'm going with that is not all the time is having freedom of choice, choosing to go to any doctor anywhere in the country, the best use of your finances if we are worried about maintaining our financial structure. Most people wind up seeing doctors that are within a network anyway. So frequently I have clients come in and say, well, I chose this because I wanted to go choose all new doctors. Perfect. That was our number one goal, and that's what we did. And then we come back a year later for our annual review, and they're like, well, guess what? I stayed with the same medical group. I changed a couple doctors. So let's look at reducing the cost of my insurance. So when you're making your list, make sure you have listed out all of your doctor requirements, any additional benefits that you would like to have. You may find that you can meet those. You'll also want to make out a list of any medications you take on a regular basis, just to make sure we have them covered. You want to make sure that when you're choosing one of these plans that have great bells and whistles, they also choose your drugs, because the last thing we want to do is go to the pharmacy every month for the next 12 months and pay full price for our drugs because they weren't covered on the plan. And then list out any other benefits that you would like to have, gyms, things of that nature, transportation. And that will help you put together your profile and match it up to a plan that would meet your needs. I kind of belaboring this open enrollment, annual enrollment. Excuse me. All that lawn mowing, I think, stirred up something in the air. So we're belaboring the when can you change, but remember, annual enrollment or open enrollment is always going to be December 15th, October 15th through December 7th annually. That's when we can change those plans that are Medicare Advantage plans. And then if we make a mistake with our Medicare Advantage plan, we get one more chance to make an adjustment for March 31st. And after that, we are in that plan for the rest of the year, unless we have a special enrollment period. Special enrollment periods, if you lose coverage provided by an employer, You become eligible for extra help. So if you did not qualify for Medicaid, but now you do, you actually have a chance to change that plan. You move outside of the plan service area, or you're diagnosed with a chronic health condition. So if you did not previously have diabetes and you were just diagnosed with diabetes and there's some support drugs that you need, you may be eligible to make a plan change then. Questions?
Yes, there are questions. Okay, so I'm going to go back a little ways, Denise, because some of these questions came up earlier. Are you saying that you cannot go to a specialist without a referral from your primary care doctor ever?
Depending on the plan design that you choose. If you are choosing a HMO, a health maintenance organization, managed healthcare, in most cases, you will have to have a referral to see a specialist. Some medical groups will have certain specialists that you can self-refer to, but you're going to want to check your plan design, so the insurance carrier's plan, and you're also going to want to check with your medical group to see if they allow you to self-refer to certain specialties. If you choose a Medicare Advantage PPO, then you do not need to worry about referrals. You just want to make sure that the physician you choose, the specialist, is in network.
Okay. Is it possible to first buy an additional Advantage plan that specifically allows you to go see a specialist without a referral?
I need some clarity on that question. So I will answer it based on what I think they were meaning.
Okay.
So is it possible to buy an Advantage plan where you can see a specialist? That would be a PPO.
Mm-hmm.
If the question was relating to whether I can have an Advantage plan and also include Medicare Supplement, you cannot do that. That's actually against Medicare's rules.
Okay.
So you have one type of plan, Advantage, HMO, or PPO, or a Medicare Supplement plan.
Okay. You said when choosing a plan, consider emergency response. What do you mean by emergency response? Like ambulance rides, or does that mean something else?
When you're choosing a plan, you want to consider, and I'm trying to think where I stuck that one in, but if we're talking about coverages for emergencies, you're going to be covered for an emergency anywhere in the US if you have a true emergency. So that coverage, regardless of what plan you choose, you will have that coverage. Some plans offer coverage for emergency evacuation via air and or land at different rates. Some offer them at the same rate. So if emergency services are something that you're concerned about, I would definitely look at those benefits when you're narrowing your plans down. And if I didn't answer that question correctly, go ahead and somebody shoot it back over and we'll try to expand on that.
You said emergency medical care was covered while traveling. Does that include walk-in clinics? And who determines if it's considered an emergency or not?
So this is a very loaded question, but I'm going to tell you how we kind of relay it. So emergency or urgently needed care, as defined by Medicare, is care that you think is necessary because you have a life-threatening event. So if you are outside of your network and you need to seek care for an ingrown toenail, probably not an emergency or urgently needed life-threatening care, right?
Mhm.
If you are visiting friends in another state and you get food poisoning and you are very, very ill and you walk into an urgent care so you can get some prescriptions to settle things down, that would be considered urgently needed care.
Okay.
Your medical group, if you're with an HMO, your medical group is going to be the ones that determine the urgency of that care. So I would just say be a really good consumer. You know whether you're really sick or whether you just have a slight inconvenience. So use your best common sense. But if you feel that your health is in danger, then that is urgently needed or emergency care. If your health is not in danger, then you might want to make a phone call before you seek care, just to make sure you're not going to be stuck with a bill.
Okay. My first choice for a hospital is level 1 trauma center, but an ambulance would not take me there because it was further away. What happens then?
So in a 911 situation, we as the patient typically do not have the access or the ability to tell the EMS providers where to take us. They have a pretty regulated system in each area that they serve, and they're going to take you to the nearest hospital that can handle the emergency that you're having. So for instance, if you were having an emergency that was not considered a trauma, and the trauma center, your trauma 1 hospital, was taking in patients from a trauma, so there's a major car accident, they're transporting there, and you are not a trauma 1, you're going to go to wherever they are dispatching that ambulance to. It's not like Uber. We can't tell them, oh, take me here, and they take you there. If you are taken to a hospital that is out of your network, but was the appropriate hospital for your emergency, once you're stable, then you would probably be transferred to your in-network hospital, assuming you had to stay for some considerable amount of time.
But I assume that's another ambulance ride that you have to pay for.
If the ambulance ride is medically necessary, you do not have to pay for it. If it's a convenience, then you do. So this kind of gets into some gray area, and trust me, I've been on a lot of phone calls battling for my clients to whether or not it was an emergency or life-preserving transportation versus convenience. If you are hooked up to telemetry, so you have an EKG, you have to be monitored, or there's an IV or 2 that need to remain connected to you for your transport, you can't really jump in your family station wagon and be transported to the other hospital, right?
Right.
If those things are not present, so there was no reason that you couldn't walk out of the hospital and transport yourself to the skilled nursing facility, then you may be looking at a non-emergency or transportation. So one of the things that I try to always tell people, and it's difficult when you're in kind of the heat of the moment, but look, can I go on my own? If you say I can't go on my own, please make sure that it's written down on my transportation request that I can't go on my own. Okay. If the doctor says you can't go on your own, then it will be paid for.
Okay, good. Thank you. Is COVID considered an emergency?
Well, that's probably a good question. I guess it would fall under the confines of how sick you were when you presented yourself for healthcare, just like the flu. Some people don't react the same way to the flu. Some people don't react the same way to COVID. So if you were picked up at your house because you were having respiratory distress and that was due to COVID and they needed to get you oxygen and transport you to the emergency room, by all means, that's an emergency. If you wake up and you're just feeling punky and you think it might be COVID or the flu, that's probably not an emergency. So we really have to draw down emergency is my life threatened at this very moment?
Okay. Okay. Is there one place, no, is there one place to go to see all the possibilities for special coverages, like the gym memberships that you mentioned?
Well, we're getting there. We're getting there. So Medicare actually is finally including some of the additional benefits in their Medicare search tool, but unfortunately, not all of them will be there. Your best bet, and I guess I keep promoting the fact that I'm going to have a job. Your best bet would be to connect with a broker who's familiar with the plans in your area, and do your plan selection based on what you're looking for with a broker who knows or who has access to knowing all of the benefits that are attached to each of the plans. What my team does, and they don't like me too much when I assign this homework, but it's good for them. My group of brokers, we have a very large spreadsheet, very large. It takes up my entire wall, but we have a very large spreadsheet, and every year we go through there and update what the carrier's additional benefits are so that we kind of have them at a glance. I wouldn't assume that everybody does a large spreadsheet, but you could hopefully find somebody that would be able to direct you. Or once you have sought out the plan that covers your basic needs, your prescription drugs and your healthcare providers, then you could probably go just pull up their coverage documents if you wanted to do it yourself. They're very proud of them. The carriers are very proud of them, and you will see on your marketing material that comes around this time of the year, some of that being very pridefully boasted. You know, we have this and we have that now. But there isn't just one quick place that you can go and look at all of those at this point in time. But Medicare.gov is getting better, so I would definitely start there.
Okay. Does Medicare have a savings type of plan that to keep money banked for separate out-of-pocket costs?
Yes, there are Medicare savings plans. They fall under the Medicare Advantage umbrella. We didn't dip into every single type of Medicare Advantage structure because we would probably be here for a couple days. But there are Medicare savings plans options out there for you. And definitely if there's one available in your area and it meets your financial needs, definitely would consider it.
Okay. If you can't go to an evidence-based diagnosis locally, if you can't get, an evidence-based diagnosis locally, can you go to a clinic like Cleveland Clinic or Mayo Clinic for coverage?
Well, that depends on what kind of plan you select. So if you're looking at a Medicare Supplement plan with Original Medicare, I believe both of those entities accept Original Medicare. If you are looking at a Medicare PPO, you would want to check and see if they are a provider within that network. If you are looking at a Medicare HMO or managed care option, then you would want to see if your medical group had a relationship with those facilities. If you chose a Medicare POS program, HMO POS program, then you could probably access those facilities under a little higher cost share under that POS program. But I would definitely take a look at what your cost share would be before you decided to use that as your solution.
Okay. Denise, it sounds like Medicare Supplement is close to what Part A and Part B provides, but Medicare Advantage is closer to private insurance that most of us are used to. Is that right?
Medicare Advantage is going to look and feel very similar to what you're used to. The Medicare Advantage must cover at least the bare minimum of what Medicare covers, but they can add additional coverages. So when we look at Medicare Advantage, sometimes, well, I'm going to play a pun on their name, but sometimes there's some advantages to you to be looking at a Medicare Advantage plan, but it's going to look and feel very similar to what you're used to. Original Medicare, because it's broken into parts, seems a little bit more confusing. But with Original Medicare and the supplement plan, if you were looking at Plan G, for instance, once you paid your deductible, your $198 deductible, then you have basically all-inclusive care. So anything Medicare approves will be paid between Medicare and your Plan G. So it's going to feel like you have a small deductible. You'll have a little bit higher premium, monthly premium, but those two things combined will give you that all-inclusive coverage. A Medicare Advantage plan will have an out-of-pocket maximum, so that's the most you pay for your health care in any given year, but you'll have some smaller co-pays or co-insurance to pay along the way. So when you're looking at the two, they're all going to wind up working well for you in the end. It's just really how things get divvied up and how you pay for them. But from a familiarity standpoint, Medicare Advantage is going to seem more familiar to us because everything is all included in one insurance policy.
Okay. Does Medicare Advantage have more comprehensive coverage than Medicare Supplement?
No, because everything is based on Medicare's original Medicare. It has to be equal to or better, but you're not going to have a vast difference in the comprehensive care. So if you were diagnosed with a catastrophic health issue and you had a Medicare Advantage plan, once you hit your out-of-pocket max, the plan's going to cover you at 100% for whatever you need, as long as it's medically necessary. The Medicare Supplement plan is going to come in and cover the expenses that original Medicare leaves you responsible for, but it's still going to cover you for all of your expenses as long as they're medically necessary. So if we start in the same starting point, we're going to go a little bit two different paths, but at the end point, we've recovered and we've made it through our catastrophic health event, they're going to provide you similar coverages. The only thing that might be different is your choice of providers. So whether you're choosing providers that are within the Advantage Plans network or whether you're choosing providers that are just affiliated with Medicare.
Okay. Okay. The other question is, when is the new information released on coverage and prices every year?
The Medicare Advantage plans, we meaning the broker community, we start certifying in July with the various carriers. Some of them are notorious for not releasing their data until the very last minute, and some of them get it out way early. So as a consumer, your information or the information that is available for us to communicate to you begins on October 1. So I technically, even though I may know the details of the plan, cannot tell you that until October 1st. Kind of stinky. Then the fees for Part A, B, deductibles, co-insurance, and premiums, those are usually announced in December.
Oh, okay.
Yeah, so they do it backwards. or in my opinion, it's never really cool when we're trying to budget for somebody and we just have to go on our best gut guess of what the premium for Part B will be next year or what the deductible will be, because they don't release those until after we've closed out open enrollment or annual enrollment.
Huh. Okay. That's tough. Okay, I think that's it. I don't think we have any other questions. Let me check both of them just to make sure. I think we're all set.
Awesome. All right. Thank you so much.
Thank you, Denise. I appreciate your time.
We'll talk to you soon.
All right. Bye.